and welcome. We're so thrilled to see so many of you join us here today to kick off 2020 AAEP Virtual Convention. Welcome to our live webinar, 10 Ways Ultrasound Help My Equine Veterinary Practice. I'm Jeunesse Castonguay at Clarius Mobile Health. At Clarius, we're dedicated to bringing affordable, high-definition ultrasound imaging to every doctor of veterinary medicine, with purpose-designed wireless scanners for small, medium, and large animals, including, of course, for equine veterinary medicine. With this goal in mind, we're happy to bring you today's educational webinar. Without further ado, I'd like to introduce you to our guest speaker, who will share how wireless ultrasound helped him start and differentiate a new racetrack practice in the middle of a global financial downturn and global pandemic, all in just 4 weeks. Dr. Christopher Elliott is a global equine sports medicine and rehabilitation expert. After graduating from the University of Queensland in 2007, Dr. Elliott started his career in mixed animal practice in Victoria. He has worked in the ambulatory department of the University of Edinburgh Equine Hospital, completed an internship at Goulburn Valley Equine Hospital, and spent 3 years in an extremely busy and successful ambulatory sports horse practice in England. He completed a residency in equine sports medicine and rehabilitation at Randwick Equine Centre in Sydney. After becoming a diplomat of the American College of Veterinary Sports Medicine and Rehabilitation, Dr. Elliott returned to the UK and worked for Lambert Equine Vets, an ambulatory vet clinic with a long association with the highest levels of British eventing. As an FEI vet, Dr. Elliott has worked at many international events, most notably at the Beijing 2008 Paralympic Games, Normandy 2014 World Equestrian Games, Blair Castle 2015 European Eventing Championships, Rio 2016 Olympic and Paralympic Games, and many more. Dr. Elliott, welcome.
Thank you very much for that kind introduction. Okay, so let's talk about making the most out of scanning the superficial digital flexor tendon. So the Sdft is the most common tendon that we're going to be ultrasounding in the metacarpal region of the horse, and the most common that we're going to be doing, particularly in our racehorse and galloping population. So we're going to be talking about some best practice suggestions, ideas, and plans. And then ways that ultrasonography can really set you apart from the crowd. High quality equipment, high quality images, and high quality reports can really set you apart and really progress your equine veterinary practice quite rapidly. So in terms of ultrasounding the Sdft, we're going to start by talking about palpation, then preparation, so preparing the leg for ultrasounding, talk to you about some scanning techniques and some tips and tricks for that, discuss measurements and recording images and why that's really important, and then also some tips for high quality reporting of your findings. So palpation, first steps first. Always palpate the structures that you're going to be ultrasounding, particularly in the lower limb of the horse. Always make sure that you are palpating, particularly your flexor tendons in your weight bearing and non-weight bearing areas. And then making sure that you really are thinking about each of the structures that you're palpating, taking the time to really feel, identify the Sdft, think about its size, its shape, the edges. Is there rounding? Is one particular side of the tendon appearing to be bigger or more rounded than the other? And then after you've done your palpation, really think about what you found, and then you'll be able to compare that to your ultrasound findings. And it's going to be able to improve your palpation technique for the future by thinking about, okay, I felt it like this, and this is what the ultrasound said. You know, the ultrasound allows us to see things that our eyes and hands can't, but using them in conjunction with each other will really improve your palpation techniques moving forward into the future. Now, preparing. This is my basic setup. I keep it quite simple. I do a lot of ultrasound, but I always keep things quite simple. So this is my little carry tray. I've got a nice pair of good quality clippers. Absolutely very much worth the investment buying yourself some good clippers. A little cloth to be able to wipe down my leg with. Sedation, I just use Detomidine, keep it nice and simple, and then plenty of gel. So this is my little setup here. This is what I carry with me to go do my ultrasound. So the little white stools, I'll explain them in a second, but really nice and simple. Don't need too much equipment. And in terms of these little white stools, these are the ones that I love. I use them all the time. This is what I sit on, and this is what I place my, my ultrasound machine or now my iPad, because of the wireless setup of Clarius. Really nice and easy, really nice and simple. Now, you can go and buy yourself these really expensive stools to be sitting on, and go grab yourself, you know, $800 worth of, you know, worth of tray here with wheels and all that type of stuff. Or buy yourself the brand new version from Photoblock for $1,800. Or just go to Kmart and do what I do and buy yourself 2 of these nice, slick little white folding stools. I love them. They're super fantastic. They're really helpful. And they allow me to be really nice and comfy and ergonomic. Now, in terms of preparing for ultrasound, I believe it's really important to make yourself nice and ergonomic so you're not getting fatigued, you're not getting sore, and be really comfy. I might look a little awkward here sitting on those tiny little stools, but for me, I can sit there for hours and hours and scan all day. It's a really comfy setup. Some people like having one kneel down on you know, a little squishy pad. Some people like those stools. There's all different ways, but one big tip that I can say for all people ultrasounding is be comfortable. Don't be fatigued. You know, once you start getting fatigued, you're not going to be able to produce those good quality images. You're going to try and rush through the rest of your ultrasound exam, and you may miss these type of things. And the more comfy you can be, the more ergonomic you're going to be, the more happy you're going to be sitting next to that horse for 20 minutes, half an hour, 45 minutes if you need. For me, most of my ultrasounds take around about 20 minutes to half an hour. And you want to be nice and comfy so that you're getting the best quality images you can. Now, in terms of preparing the leg, I believe it's really important to take your time prepping that leg. The better you prepare the leg, the better ultrasound images you're going to get, and the happier you're going to be in terms of your outcomes. So for me, I clip the very vast majority of all of the ultrasound distal limbs that I do. Most of the time, it's a relatively obvious lesion and you're suspicious of a lesion through the clinical signs, presentations, pain, heat, swelling. So clipping is going to allow you to get a better quality image. However, with some ultrasound machines, you will be able to get away without having to clip the leg. This Clarius wireless setup is actually really great without having to clip the hair, which is fantastic for your sport horses, for those short show horses, for those lesions where I'm not quite sure whether this has an ultrasonographic lesion or not, and you don't want to clip the leg to highlight it to the rest of the world. You can just get that gel on, rub it in, and get good quality images without having to clip. And also, when you find a machine that allows you to not have to clip the hair, it means that you can monitor cases a lot more whilst they're, say, for example, out competing or out showing. You don't have to clip the leg every time. If you do have an obvious lesion, though, for me, I think it's going to make your life easy if you do clip it. And then wipe it clean with a clean cloth. Some people like to wet that cloth down to get all that hair off. I just use a nice dry cloth, and then I can have that dry cloth later to get rid of the gel later and also to clean my hands. And then your gel. Give the gel time to work in, rub it in, and then let it sit on the leg for as long as possible. So for me, I palpate my leg. I then sedate my horse. Majority, again, of my horses I sedate. Makes your life just so much easier if the horse is standing still. So I palpate, I sedate, I clip, then I put the gel on, and then I go start getting my ultrasound machine ready. By the time my ultrasound machine is ready, my gel's had a few extra minutes to soak in, and then that's going to allow me a better outcome in terms of gaining the best possible images. And so setting up my machine, well, these wireless setups are so simple. For me, I keep the battery separate. I plug the battery in, I turn the machine on, I turn my iPad on because it's wireless, and there I'm ready to go like 2 minutes later. Some machines, you know, some of the more traditional machines take a little longer to load, and you've got to kind of change a couple of settings and things like that. But knowing how your machine sets up is really, really important, and being familiar with your machine. And obviously the quicker they turn on, the better usually. These Clarius systems turn on really quickly, nice and simple to use. So in terms of scanning technique for the SDFT, a lot of these principles are directly applicable to ultrasonography in any location of the horse. But what I do and what I would advise people to do is start from the top to bottom and work your way through the leg in a really systematic, repeatable way. Do the same thing each and every time. What I do is I start with a preliminary survey scan, and I would thoroughly recommend that you all do that. I preface this with my owners and my clients and my trainers by saying, all right, guys, I'm just going to have a good look at this leg. I'm going to sit here. I'm going to be quiet for a while. I'm just going to have a look and just see what's going on inside that leg. Now, that preliminary survey scan just gets you a gauge of what lesion are we dealing with, what structures are we dealing with, where are we, that type of thing. But a big tip, if you preface with your owner, trainer, rider, I'm going to sit here for a little while and be nice and quiet, then they know that that's normal. It's not they don't get kind of freaked out by the awkwardness of silence. And then also you preempt that classical sport horse or show trainer that as soon as you put the probe on, they're like, what, do you see anything? Do you see anything? What's going on? So for me, I just tell them I'm going to sit here nice and quietly and just start looking at the leg. The longer I don't say anything, the better. So once I've done my preliminary scan, I've got an idea of what's going on. I'm then going to go back up to the top and be systematic and go through and get my representative images of the whole SDFT, the whole structure at regular intervals, somewhere between every 2 and 4 centimeters. I'm going to be measuring cross-sectional areas through those regular intervals. And then once I'm getting to my lesion, I'm going to take more likely a whole bunch of lesion-orientated images and lesion-orientated measurements. And then throughout this process, top to bottom, systematic, representative, thinking about making sure that we are seeing them in cross-section and longitudinal. I personally get all my cross-sectionals first, then get all my longitudinals. Plenty of veterinarians like doing cross-section, longitudinal, cross-section, longitudinal at the same location. Doesn't really matter, just as long as you're doing it in a nice systematic way, making sure that you are getting all of the things that you require and saving them for your records. So this is the little wireless setup. You can see how nice and easy it is. It fits nicely in my hand. You'll see my index finger there. It looks like it's sitting on top of the standoff holding it in. It's not the standoff sitting there. It's a little guide, like it's a little guide. So I can use that little finger to kind of poke around and make sure I know where I am on the leg, because I'm not looking at the leg, I'm looking at my screen. But that's how I hold my probe for a cross-sectional and obviously longitudinal the other way around. This is me ultrasounding a proximal suspensory without being clipped. This is a thoroughbred racehorse that he saw behind and overloading in front. He was a bit painful on palpation. I didn't want to clip him up because I wanted to keep him racing. Ultrasound showed no lesions. He was just sore because he's overloading in front. Right, so this lesion here on this video, an edge lesion. So for me, I always put medial of my images on the left. That's what I've always done. It's what I was taught. So every single image that I take, medial is on the left. I don't label it because I know that's where it is and they're always the same. Some people will label whichever side they're medial and lateral, and plenty of people like lateral on the left, you know, like to have it kind of surgically orientated, as in, you know, to mirror images of things. It doesn't really matter as long as you know what you're dealing with. So this is our scanning technique. So I'm working nice and smooth down the leg. You can see the extent of the lesion. So I'm starting at the top of the lesion. I'm moving down the leg nice and smooth until I'm getting to the bottom of the lesion, and then I'm moving back up. So just video to try and show nice, smooth movements up and down this leg. So another lesion here. We're now on a lateral edge lesion. So starting at the top of the lesion, moving our way down, finding out how big our lesion is, where it's involved, getting to kind of the bottom, the severity of it about here. And then, so just a nice smooth. So this is my survey. This is the first scan that I'm doing. I'm just seeing what's going on inside the leg, moving a nice fluid pattern from top to bottom, surveying what's going on, and then we're going to go back to measure and document and identify this lesion. So measuring and recording. First of all, for me, I think the easiest way to record where the lesion is in the leg is measuring distal to the accessory carpal bone. So I have a little ruler that lives with my ultrasound machine, and I measure from that point of the accessory carpal bone down to where my lesion is. Now, for me, I think this is the easiest way to record where your lesions start and finish and where the severe points are, because it's definable. It's 12 centimeters below the accessory carpal bone. You'll read and you'll certainly see plenty of veterinarians talk about zones, zone 1A, 1B, 2A, 2B, 3A, 3B, 3C. That can be quite variable between each horse, and also the distinction between, say, 1A and 1B can be variable between veterinarians. Measuring distal to the accessory carpal bone, it's definable. It's literally numbers of centimeters. It can also be extraordinarily helpful when you're communicating and that horse is then going to another veterinarian. They can just put a ruler on, plonk the ultrasound machine, and boom, that's where the lesion is. And then also really good for following up in terms of your rehab, because for me, this is what the majority of the reason we're ultrasounding, we're taking our time and effort to measure and record all this, is so that we can monitor rehab and ensure that we are getting these horses healing right so they can get back to athletic performance. So in terms of some examples of the way I label and the way I measure, I write down DACB CM8. The reason I do that in that order is because then you can click on your little annotation and just delete the last number and then type in, say, 12 next. You don't have to then go delete all the others. So it seems a little bit backwards that we're going distal to the accessory carpal bone CM8. So for me, I always put my labels on the bottom left-hand corner. A lot of things, just like any type of diagnostic imaging, if you can try and be doing it the same way each and every time, then all your images will look nice and uniform and nice and repeatable. So measuring cross-sectional area is really important because we can define how much damage we have, and literally put it into numbers. So the ability to have a cross-sectional area measurement in terms of your ultrasound machine is absolutely vital, and ideally the easiest way to use it as possible. This Clarius is a touch screen on your iPad, which is just so easy. Trackables, after a while, you get really good at using a trackable, but when you're starting out, the trackables on the traditional ultrasound machines can be tricky. They can also get really dirty and kind of cloggy and clunky. And then in terms of knowing about your cross-sectional areas of your SDFTs, majority thoroughbred racehorses are going to be around about that 0.8 centimeters squared, 0.7, 0.8, maybe 0.9, and they're going to be very similar, within 10 to 15% left and right. You do sometimes see a little bit of variation, but they're very similar. So we can already start seeing in this example at 8 centimeters, that distal accessory carpal bone, that this tendon is starting to become big. And so as we trace this down, we're looking at 12 centimeters. So you can see I'm going kind of, I recorded at 8, but I did actually have a 4 centimeters, 8, and I went 12. Now I'm starting to see a lesion. So I'm going to go and take images every 2 centimeters. So we're starting to see here that the size of our tendon is starting to become bigger and bigger. And we're starting to see loss of echogenicity, loss of fiber pattern here, and then the beginning of a very irregular core lesion. So we're measuring our cross-sectional areas. And then also by having an ability to measure cross-sectional areas, we can start measuring the lesion size. So we're looking at a tendon that's close to 200% compared to 100% bigger than the other side. And in terms of if we look at the measurements of our cross-sectional areas, so we're looking at 6 on 160 or 8 on 140. So we're looking at a lesion that's maybe somewhere between kind of 4 and 8% damage. And that can be really nice for clients just to get in their mind of the size and the severity of damage. And we can see here we're moving down the leg. So I'm still measuring it every 2 centimeters distal to the accessory carpal bone. And we're seeing that this lesion is relatively long and that our tendon is quite big. A reminder to always make sure that you do your longitudinals. In terms of labeling, I have not labeled this correctly, but I should be labeling it something like 12 to 16 centimeters distal to the accessory carpal bone. Most ultrasound footprints, the size of the footprint of your probe is around about 4 centimeters. So the image kind of from left to right is usually about 4 centimeters long. And so that gives you a gauge, and it's a really nice way to kind of move down your leg in a nice systematic way when you're doing your longitudinal images. So the ability to measure cross-sectional areas is really important when we're communicating to our client, what's actually going on. And this slide is to remind us all that it's absolutely vital that we always ultrasound both legs. First and foremost, we don't want to miss a lesion in the other leg. Let's take thoroughbred racehorses and SDFTs. A small proportion of them will actually have bilateral lesions, one more severe than the other, but you don't want to miss that bilateral case. And then also the beauty of any horse is that the vast majority of them are symmetrical left and right. So when you have a damaged one side, you have a normal control on the other. So something to compare to. So particularly when we're looking at sizes of structures, comparing to the other side is really important. So if we look on the right-hand side of our screen here, we're seeing the normal unaffected right fore SDFT at the same distance below the accessory carpal bone. And we're seeing that our cross-sectional area is 0.8 centimeters squared or 76 millimeters squared. So like I said before, that's very normal for a thoroughbred, somewhere in that 0.7, 0.8 range for our SDFT. And then we compare that to our damage side, which is 1.4 on our left. So we can see it's double the size. And being able to show this to your clients, that's really obvious for them. Ultrasonography for lots of trainers and owners, they get it, they understand, they know what they're looking at. But for plenty more, it's just fuzzy shades of gray. And when you can put outlines on them and put green dots around something and put arrows to things and make it look a little bit more obvious, they can understand what you're doing more and really grasp the injury that's occurred. So like I alluded to before, lots of people ask, well, why take so long? Why make so much effort measuring and recording? Well, for me, it's the monitoring of your rehab. It's for monitoring your healing process. If you don't know where you start, you don't know how you're going to be able to monitor that healing process and then be able to advise your clients what's happening during rehab. And now, if you start off getting a really nice set of images, then as you monitor the case through, each and every follow-up image is going to be quicker and simpler. But if you show to your client the good quality images and explain to them why we're doing all this, they're going to be more likely to get you back every 3 months as this horse is rehabbing, and then also be more likely to be proactive in terms of monitoring it once it's back into athletic performance. So the better you do your first ultrasound, the more likely you're going to get more ultrasounds, and that's more likely, building your business and building your practice. I truly believe it's really important to take the time to record your quality images. So for me, it takes 25 minutes, half an hour to get a really nice comprehensive set, left and right legs, explain all that. When I first started out, it'd take a lot longer. You will get better and quicker as you go. But for me, I think it's really important to take the time to get those good quality images. The clients can recognize good quality images, most of them. And then also take pride in those images so that you're happy for other veterinarians to view them. Kind of like every time you take an x-ray, every time you do a diagnostic images, think what would happen if another veterinarian read this and looked at this? What would they think? Particularly important for soft tissue injuries that are going to take a long time for rehab. These horses may end up under other veterinarians' care. And if you can provide that other veterinarian with good quality images to start with, then that veterinarian's job is going to be easier, and then they're more likely to kind of think a little better of you. So we talked about this a little bit, but let's just recap it. So measurements and recording, we're measuring every 2 to 4 centimeters, about every 4 centimeters for your survey, taking those representative images distal to the accessory carpal bone, making sure that your ultrasound machine does have the ability to measure those cross-sectional areas and multiple cross-sectional areas in the one image. Looking at your total cross-sectional area versus your lesion cross-sectional area, and then also your cross-sectional area of your normal leg compared to your damaged leg. Always doing cross-sectional and longitudinal. And then making sure that you are saving your images for your own clinical records and then potentially communicating to other veterinarians. But also think about videos. Videos are a fantastic way to get a really nice summary of the whole leg or a really nice summary of the area within the lesions. And it's a brilliant way to communicate to other veterinarians within your practice. And also other veterinarians, say, for example, like a pre-purchase exam or sending videos away with the horse that's then going to be under the care of another veterinarian during its rehabilitation phase. So we've got all of our images. That's great. We've told our client on the farm what's going on. Now, writing reports. For me, it's something that can really, really set you apart. And it absolutely does set me apart in terms of my business. Clients, owners, trainers, rehabilitation staff, they see good reports and it makes their life easier. Writing a good report really does allow the follow-on and the further management of this horse to be so much more effective, and it really kind of sets you apart as a veterinarian. Yes, it does take a bit of time, but if you create a template, and feel free to copy my template and copy my wording, that's no problems at all. But it can really set you apart and allow good quality care moving forward, and particularly makes the life of your trainers so much easier, particularly say, trainers that have multiple owners of a horse. They can just go, here's the report from the vet. That's everything you need to know. Pictures say 1,000 words. Copy and paste those images into that report. It allows the client to really kind of grasp what's going on, and particularly for owners that aren't there at the time during your exam. So this is my basic spiel. This is my template. I change it for each and every case, but this is the basic kind of format here. So hopefully you can see the slight yellow highlighting. So we're going to make sure that we're talking about the date, the name of the horse, which leg it is. So talk about the palpation, just to make sure that everyone knows that you did take the time to feel that leg and record your findings. Get a grade. I mean, grades from 0 to 4, the grading system is quite well understood in terms of Sdfts, but clients like a grade. It gives them a bit of an idea of severity. And then measuring the length of our lesion gives, again, the gauge of how much damage there is. I currently have a paper in the works. We're just going through the stats on outcomes of thoroughbred racehorses here in Australia. And the multivariable analysis at the moment is showing that what appears to be the most important in terms of prognosis is the length of the lesion, not necessarily the size of the lesion, but we're still working through all the stats. And then this little sentence at the bottom here, at the most severe point, and then locating the most severe point, talking about the total size of your damaged leg, and then talking about the size of your core lesion. Clients really like that idea. Okay, this is where's the worst bit. This is where the worst bit is. This is how bad it is. Gives them a gauge, really nice and clear and succinct.
Dr. Elliott, if I can just pipe in here, this is a really, you've presented so many best practices today, and this reporting one and your level of detail and the inclusion of such high quality imaging, I just want to emphasize how, you know, how that really helps set your practice apart. It helps build loyalty with your customers. And what we've seen as well with many other physicians is really excellent reporting can lead to a lot of referrals as well.
Yeah, absolutely, 100%. So let's take my example. You know, instantly once I turned up with this ultrasound machine, the clients were like, wow, that's so much better than the other guy in the area. And then once you show them that you've got good quality ability to diagnose, and then you give them plans and reports and all that, they bring you more horses to scan. And then also you take that referral example, it's probably about 10 days ago now, but I got a call from a trainer who lives a couple of hours away. The leg, you know, they just knew there was something wrong with the leg. They've had it scanned by their local vet, you know, country vet. You know, he ultrasounded, he scanned it. He said he couldn't see a lesion, so they kept training it. The trainer knew there was something wrong, so he sought an extra opinion. They found me. They drove the horse 2 hours to me. We ultrasounded it. Yes, there was no lesion, but the tendon was 120% bigger than the other side with just some loss of echogenicity. So it had a tendonitis, but you know, good quality images, good quality ultrasound gives you that good quality advice. And clients and trainers do understand that.
When they're able to see that lesion so clearly there, it probably helps in terms of getting trainer and owner buy-in into, you know, letting the horse rest and recover as well, right? I mean, the picture tells 1,000 words, like you said before. It probably helps with getting, you know, making sure that they don't put the horse back into heavy training too quickly.
Exactly. And so your arrows on your reports are really helpful. In terms of when you do put your images in your report, put a little summary spiel, put a little caption on it, you know, make it relatively simple and easy to understand. And then comparing your left and right is really helpful. You know, it's just so obvious to a client when they see that, okay, that's normal, that's damage, I get it now. And then kind of like what Janice just alluded to was sometimes the healing isn't going as well as you want it to be, or it's going okay, but the client wants to get the horse back sooner. And so you can't really argue with the images. You know, it's not my opinion. It's let the ultrasound speak for what it says. So this is a racehorse. It had an edge lesion. We get a lot of edge lesions here at this particular track. They felt the leg was great. And palpation wise, it was brilliant. But you put the ultrasound on it and you can see that right side image, we're not there yet. We haven't quite got that healing. So we can ultrasound, we can put this report together. He can send it to the multiple owners of this horse and everyone can understand it's just not ready yet. So you don't get that pressure to have to push this horse back into training when it's not ready. So for me, the follow-up and the rehab and comparing to your original images to now shows you whether you're healing appropriately or not, and allows you to make that decision when can the horse return to training. This is a handy little way that I kind of highlight which is the damage and which is the normal bit for longitudinal, because you'll be surprised that so many clients, they look down here or they look up here. You know, put it nice and obvious for clients so that they can see where things are going wrong. Now, in terms of reporting, and again, you know, I'm a diplomat of the American College of Veterinary Sports Medicine and Rehabilitation. anyone can plonk an ultrasound, well, most people can plonk an ultrasound machine on a leg and find a hole in an Sdft. But the rehab part, getting the horse back to work, is the key. Now, this is my gold standard diamond encrusted every month planned out perfectly. Now, not many clients like this type of program. It's a bit too much for them. It's my dressage client who just needs to know all the information absolutely now, and it needs to be exactly the way it goes. But what it can be is a little bit too much detail for a lot of people. And it's really important that you have a structure and a template for your rehabilitation plan, but you are tailoring it to each and every individual horse. So for me, with my thoroughbred racehorses here at this particular practice, this is my basic setup. I have I break it down into 3-month groups. They rest for 3 months, then they walk, trot, canter. I break it down a little bit more simply for these guys because they kind of live in a world every 3 months they do something. And then probably what's the most important thing is that highlighted, bolded area. Repeat ultrasound at the end of each group will determine whether we can progress to the next stage. Now, if you tell a client it's going to be trotting in 9 months' time and it's not trotting in 9 months' time, they're going to be disappointed in you. It's not your fault. It's just the way the horse is healing. So if you do really emphasize that as the key to progressing to the next stage, first of all, you're doing more ultrasound. Second of all, you're being constantly involved with the horse as rehabilitation. And then you are making evidence-based informed decisions. If the tendon doesn't look good, it's not ready to progress. If it looks great, it's ready to progress. Let the black and white images allow you to make the informed decisions.
Dr. Elliott, all those really precise measurements that you're taking and all that clear image that you're providing, you're putting that in your repeat examination.
Yes,
reports,
absolutely.
Right?
So the repeat, you can quantifiably define this leg is now back to inverted commas normal size, or it used to be 1.7 and now it's 1.3. So you're actually defining it, and then also you have actual numbers to tell the client it's better, because clients often hang on a number. You say it's 1.7 centimeters squared. And so then when you tell them it's 1.4, they go, oh, that's so much better. So you've got definable numbers that you can measure and compare to. And then also in terms of those definable measures, in terms of say cross-sectional area of the Sdft, it may never fully come back to the perfect other size, but it might look ultrasonographically good and you're ready and you're working through, but it's always 20% bigger. But moving forward for the future of that horse, it's really important that you document that at full work, it's 20% bigger. So it's 1.2, but it's show jumping and competing. So it's always going to be 1.2. But then if it damages, for example, and it goes to 1.6, then you know it's getting bigger. So yes, all the precise measurements at the beginning, follow through all of these and allow you to definably quantify the healing process.
Do you at times find that perhaps it's degrading and getting worse because they haven't been following your rehabilitation plan?
Yeah, yes. Rehab doesn't always work. When they say, you've got a 90% chance of getting to athletic performance, well, that still means 1 in 10 go wrong. So yeah, absolutely. When things are going wrong, again, it's that definable, quantifiable thing. So for example, if you measure it at the end of the walk phase, and let's just say it's 1 centimeter squared, and then you go, okay, well, that looks great. I'm really happy. Let's put it back into trot. And then halfway through your trot work, they're noticing a little bit of heat, and you ultrasound it again, and all of a sudden it's 1.2 centimeters squared. It's gotten worse. So it's not coping with the trot work. So then you need to go backwards. So if I flick onto this phase, this top little thing is probably the best wording I have in terms of any report. It says here, please note that these protocols are a guide and must be varied according to the tendon's clinical and ultrasonographic appearance. So make sure you're palpating those legs. if any of them shows poor healing or something's going wrong, then we need to go back. You know, we need to take a step back, go back 4, 8 weeks, 12 weeks. Sometimes you've just got to go, okay, this horse just isn't coping with trot. We need to go back to walking this horse. So plonking that at the end of your reports is like your get out of jail free card, but also it's really just emphasizing to your client that these are animals, this is biology. They don't read the textbook. If the textbook says it should be better by now, but it's not, well, for whatever reason, that horse just isn't healing as you ideally want. And then a few other little bits of advice. I mean, no hoof, no horse farriery is vital for rehabilitation of many, many, many soft tissue injuries. So really important. And then just other little kind of things. So feel free to copy that. But that little note that says is a guide, and you've got to make your you've got to make your decisions of rehab based on your follow-ups. So like I alluded to before, great reports do set you apart from the pack. I really do believe that. I know it does for me. They're really helpful for those trainers and managers, particularly when the horse is moving to another location for rehabilitation. It's going under the care of another veterinarian or going under the care of a different manager, someone looking after it. Ideally, it's great when you get to then go follow that ultrasound up at the rehab place. And that happens to me a lot, because the trainer and the owner, they go, wow, you know, like, you've done such a good job. You're so comprehensive. Can you go to the rehab place and follow it up? And like, yeah, absolutely. And then all of a sudden you start working with the rehabilitation facility, and then the rehab starts seeing that you're that veterinarian that sends the good reports with the good plans and the good cases and the good images. And then that sets you apart from, say, the other veterinarians that are sending them cases. And all of a sudden, you know, you might pick up a bit of work here and there, more referrals, more work. And like anything, I think it's really important that we all take pride in what we do. Yes, we're all busy, and yes, you know, some of us don't have the time to spend 20 minutes scanning a leg and then 20 minutes writing up a report. But I do think it's really important to find the time, take the pride in what you're doing, get good quality images, write good quality reports, and be happy that other veterinarians are going to read it. Because I know from when I worked in referral practice, when I receive good quality reports from that veterinarian, I never met that veterinarian. All I can judge that veterinarian from is how he or she wrote her reports. And if she's written a really nice report with really nice images, I'm probably going to just be in the back of my mind, oh yeah, you're that veterinarian that writes great reports. You know, little things go a long way. So hopefully that's been helpful in terms of, you know, discussing how I go about ultrasounding the SDFT and what I believe is a best practice and ways that you can improve the quality of your SDFT scanning. Same principles for scanning anything in the horse's leg. Let's talk about some of the ways that particularly this wireless ultrasound machine has helped my practice in these challenging times. So you can see from what I've put here, brilliant images. This wireless system that I have now has really, really, really good images, and good quality images is the foundation of good quality ultrasound. It's also really affordable. I mean, one of these wireless systems is, or 4 of them really, that 4 of these systems is about the same price as your traditional nice, good quality traditional system. So they're so affordable, and particularly for setting up a brand new practice. Like, this is the first piece of equipment that I bought, and it was an absolute must for me. And I've been able to, you know, pretty much pay it off already, which is absolutely fantastic.
We were chatting earlier, and you were saying that, you know, the affordability of the unit is one of the things that helped in setting up your practice in just 4 weeks. Yeah. I'm wondering, how long did it take you to learn how to use it?
4 minutes.
Okay.
It's so simple, like unbelievably quick and easy, really easy to learn how to use, unlike lots of other machines. In terms of affordability, you can really go on to those established practices where you can actually afford to buy a whole bunch of ultrasound machines and get an ultrasound machine in every veterinarian's car. The more ultrasonography you do, the more ultrasonography you will get. If you have an ultrasound machine in your car, you're more likely to go, oh, look at that fetlock, we'll x-ray it and ultrasound it. Or, oh, that's a little bit questionable, you know, we probably should ultrasound it. And the client's maybe 50-50, and you go to the client, hey, we don't need to clip it, and I've got an ultrasound machine right here. Then bang, you're in, you're done. You'll be able, you can do more ultrasound if you've got one in all of your vet's cars, particularly for young veterinarians. The only way they're going to get better at ultrasounding is to do more ultrasound. And these are so simple and easy. And because there aren't cables and things, there's nothing really that can break. Like, nothing can really go wrong with it.
So portable, right? And Dr. Elliott, this reminds me of your little foldable seats as well. Some of those more expensive seats would be kind of clunky to take out from the car and bring next to the animal. So heavy, right? And you've got everything 100%. In that nice little cart.
Yeah, and it's so quick. You know, for me, I think the quicker you set up, the more likely there's buy-in, you know, to the procedure. You know, like you go, oh, where's the PowerPoint? Where can I put the horse? You know, where's the cable going to go? Then I've got to get this heavy machine out and wheel this big trolley out. And then all of a sudden it takes you half an hour to set the machine up. And then it takes you 20 minutes to ultrasound it. And then it takes you 10-15 minutes to set up. And all of a sudden you've wasted an hour and you've only made X amount of money. Whereas if your machine turns on quick, you literally just grab it out of the car, plonk it on the leg without having to clip it, scan it for 20 minutes. Like, you've made the same amount of money with less expense in a shorter period of time. So yeah, absolutely. The portability is just brilliant. And you've got to have that easy setup, make life easy for the clients, because if it's easy for the client, they're more likely they're going to get you to do it. In terms of quality images, absolutely, this wireless setup is better than many of the traditional systems and equal to some of them as well. And for the price, like, the cost benefit is amazing. Like, for the price, the ultrasound images are brilliant. And yeah, so we were just talking about billing. You know, obviously, the more you bill, the quicker you pay it off, and the cheaper the machine is to start with, the more likely you're going to pay it off quicker. So the more ultrasound you do, the more ultrasound you'll get. The better you do it, the more reports you'll write. The more reports you write, the more referral work you get, and all of a sudden you're building and generating your practice that way. I don't have an X-ray machine at the moment. I can't quite afford that yet. I get one of my friends who owns a veterinary practice around about an hour and a half north of here. He sends a junior vet to come and X-ray for me. But you don't need it in certain circumstances. I mean, so far I've diagnosed a couple of avulsion fractures. I've seen joint fragments in the front of fetlock joints, and also fractured sesamoids. So I haven't had to, I've probably not used my X-ray machine as much as I usually would, because I've got an ultrasound machine. As we were talking about, it is so small, it does literally fit in your pocket. You can take it anywhere. I travel a lot in terms of doing sport horse practice in lots of different places, but also travel a lot for pre-purchases. Taking an ultrasound machine with you in terms of pre-purchase is absolutely fantastic. And this is so small and easy, just put it on your carry-on. And then, like I said right from the very beginning and a few times throughout this presentation, having that new good quality technology builds your credibility. You're the guy with the good ultrasound machine. You're the guy or girl that knows how to ultrasound. You're the guy or girl that's able to get good quality images, good reports. That's what builds your credibility within clients, within trainers, within communities, and then, you know, in terms of referrals as well. So right from that very beginning, that first slide, we're talking about best practice, high quality equipment, high quality images, high quality reports allows you to practice high quality veterinary medicine. So hopefully that's, I mean, thank you very much for listening. It's been a really pleasure to talk to you. Hopefully that's all given you some helpful tips, and just explain how, you know, ultrasound for me is vitally important, and in these challenging times, this is certainly really affordable, and it's made my veterinary practice.
Thank you so much, Dr. Elliott, for sharing your ultrasound techniques and all the beautiful clinical images that you showed us today. Thank you so much. Dr. Elliott is going to be here in just a minute to answer live questions from everybody who's joined us today. But before we start our live Q&A, I'd like to just take a minute to introduce you all to Clarius HD Vet. the highest definition wireless ultrasound imaging to speed diagnosis for small, medium, and large animals. Our L7 linear vet for equine scanner is specifically designed for clear, detailed imaging and delivers several advantages. Clarius is unrivaled for near field and high resolution imaging in handheld ultrasound with dedicated equine presets. This best-in-class imaging of muscles, joints, ligaments, tendons, and cartilage, both in rest and in motion, as you saw today, has never been easier and more affordable. Clarius shows you all the fine details you need to quickly investigate an area of concern and make a confident diagnosis. Each scanner is designed with 8 beamformers that deliver the image quality only found in traditional systems, but at a fraction of the cost of cart-based systems. Artificial intelligence replaces complex knobs and buttons, making our scanners super fast and easy to use. Clarius is also wireless, freeing up space with zero footprint for portability in a variety of settings from the racetrack to the stables. You get free movement with no wires getting in the way, also making it so much faster to clean and disinfect. Only Clarius delivers a wireless scanner for equine with a free ecosystem that includes free apps for your iOS and Android devices with free updates, unlimited cloud storage to capture and manage your exams, and for unlimited users at no additional cost. Clarius has no subscription fees, so you can buy a single device in your practice and share it among your veterinarians, each of you with your own Clarius cloud account and with your own app on your own personal devices. With increased ultrasound billings, you'll see a rapid return on your Clarius scanner. One last slide before we begin our live Q&A with Dr. Elliott. We want this webinar to focus on educational content, but we do also want to make sure that if you're curious about Clarius, that you have an opportunity to learn more. So we're just going to open up a quick poll here before we open up the floor to questions. And this is an opportunity for you to engage with us and learn more about our Clarius vet scanner. You can request pricing, and please do go ahead and click any and all of these that apply to you. We'd be happy to give you pricing information and provide you with a quote. You can speak to one of our experts about the advantages of a wireless system or with any questions that you may have. You can go ahead and book a Clarius demo. We can do a one-on-one live demo with one of our clinical specialists. They'll probably scan their own leg for you. Or you can give us a call if you've used ultrasound before and you're interested in discussing the feature functionality that comes with the Clarius HD Vet. You can go ahead and select that option as well. Or if you'd like to watch some more tutorials, go ahead and pick the last option here. So I can see quite a few people voting. I'm just going to give you 5 more seconds here to select one of these options, and we'll be happy to follow up with you in the coming week. 5, 4, oh, we've got more people voting. 3, 2, 1. All right, we're just going to end the poll now and go to our live Q&A session. So in your Zoom session, you should see a question tab. Go ahead and click that and put in your questions, and we will ask them of Dr. Elliott on your behalf. So let me find these questions. On to the questions. Can I use the same probe you showed for other applications? Any procedures, for example?
Yeah, so it's a linear probe, so you can use it for all musculoskeletal. I've put it on necks, and I get a reasonably good image on the facet joints. So for ultrasound guided injections, absolutely, you can use it for any of those types of things. Any type of ultrasound guided procedures. And I haven't done any yet in this particular practice that I'm at, but ultrasound guided injections, say intralesional biological stem cells, PRP, that type of thing. So yeah, absolutely. It's got quite a range of multifunctional, and just yesterday, I ultrasounded a hamstring. So even though it's just a linear, you can still get quite decent images on some of those deeper structures.
Is a standoff required for your exams, and how does it benefit?
So I always ultrasound, like looking at superficial structures, I always ultrasound with a standoff. The standoff literally allows you to stand away from that near field and gives you better images on that near field. The first 2 or 3 weeks that I had the probe, I didn't have a standoff. And I still got very good images of the Sdft and all the deeper structures. So yes, I personally use standoff all the time. when I'm ultrasounding a distal limb, but some people won't. You can still get good images without it. And some of those deeper structures, you don't need to stand off at all. So it can be very beneficial, but highly recommended, but not necessary.
Another question for you, Dr. Elliott. How long does the battery last?
Yeah, so it lasts about an hour of full-on scanning. So I get 2 really good quality cases, 2 horses with a full proper left and right scan, compare, contrast, record images, videos, measures, all that type of stuff. I'll get 2 horses out of 1 battery, still with a little bit left. I could probably squeeze in a little bit more, a quick little scan out of 1 battery. I have a spare battery. I purchased one of those, which would get you another hour. So between 2 batteries, yeah, you'd get at least 2 hours of active scanning, which is a lot of scanning in one day. So
you can always be charging the battery that you're not using as
absolutely.
well to get that continuous scanning that if somebody's looking for that.
It's the box that the machine comes in, it looks like an iPhone box. So it's like your phone / ultrasound at the top, and you take it out and there's a charger underneath and a plug and everything. It's really schmick when it arrives. But yes, it comes with, you can always keep charging it if you need to, but one battery, 1 hour of full-on scanning.
Another question for you. Would you prefer ultrasound or MRI to visualize insertion of the suspensory ligament branch onto the sesamoid bone?
Ultrasound for that one, I would say. I don't think it's necessary to go to an MRI for that. You get everything you need from an ultrasound.
Can you use regenerative therapy treatments, stem cell, PRP, along with ultrasound? And is that billable as well?
Oh, yeah, of course. Yeah, absolutely. So your ultrasound guided injections, intralesionals of your biological, and yeah, so you're adding, you'd add an ultrasound guided injection charge, and then obviously your biologicals as well. So yes, having the ultrasound in your practice allows you to do ultrasound guided injections, and obviously that comes with a procedure fee as well.
Is the probe water resistant?
Yeah, absolutely. So basically, when I finish scanning, there's the little white end to it, and then the black handle, and then the white battery at the back. Basically, anything from the black forward, I just put it under the tap. It's really easy to clean. It's really robust. It doesn't feel delicate, but basically once I finish scanning, I wipe it down with my little towel and then just shove it under the tap, really nice and easy.
What is the sonographic appearance of recovered tissue?
Okay, so basically in terms of healing, we're going to be seeing that lesion go away from black and turning back to white, essentially, is a really simple explanation, but we're going for that hypoechoic to more hyperechoic, so returning to a more normal appearance, and we're looking at the structures around the lesion for our guide of what we want it to be returning normal to. And then in terms of tendinous or ligamentous structure, we're looking at a return to linear, even, more normal appearance of those fiber patterns. So we're looking at the echogenicity returning to normal, so from hypo to more hyper, to a more regular appearance in terms of echogenicity. We're looking at our fiber pattern to returning to more linear, regular structures. And then we're looking at our overall size of our structures to be reducing from their inflamed, damaged, enlarged state to a more smaller, more normal state, with the knowledge, knowing that scar tissue or healing tendinous structure has a different collagen components, and most of them will never truly get back to exactly perfect appearance.
We've got another question here. In the case of ultrasound guided injections, how can you keep the probe sterile?
Yeah, good question. So for me, what I do is I put a sterile glove over the top of it. So I create a sterile environment, obviously sterilely prep the leg, and then I place the probe inside I put a little bit of gel inside a sterile glove, and then I place my probe inside the sterile glove, and then with sterile hands, I then hold that in a sterile way. But I do believe that Clarius actually has specifically made sterile sleeves for these systems. I haven't seen them, I haven't used them. I personally would just go with the sterile glove, but I think if you're doing lots of them, I do believe they Clarius makes specific sterile ones for this, because there's a huge amount of these systems in the human field, and obviously that's a big deal for them, even just between patients to patients, having a sleeve that comes on and off, particularly.
Yeah, there's definitely sterile sleeves available on our accessories page on our website.
Super. Yeah, so you can buy them specificy. I haven't seen them. I assume.
Perfect. I know we've gone a little bit over time. I'll just ask you one final question. Thank you everyone for all your questions. Is the image quality of your wireless scanner as good as traditional ultrasound systems?
Oh yeah, better than some. Yeah, better than some, better than a lot, really, and on par with the majority. Yeah, absolutely. Like the image quality compared to traditional big machines is really good.
Great. We've gone a little bit over time here. If we didn't get to your question, we promise to follow up with you in the coming week. Again, you will receive a copy of the PowerPoint slides that were presented today, as well as a recording of the webinar. I'd like to thank Dr. Elliott for joining us in kicking off AAEP 2020 with such a tremendous presentation. Also, a very big thank you to you for joining us today. We hope to see you in our booth or in our Zoom room tomorrow at the conference for a live demo with our ultrasound specialist, Emily Ma, who you can see here. She is excited to have you join her tomorrow for a live demo. Our team will be there from 1 to 6 p.m. Eastern, Monday to Wednesday this week. In the meantime, I'd like to wish everybody who joined us today a wonderful and happy evening. Thank you so much for joining us. Bye-bye.